Today I want to talk about a person who came to me with what we call as a secretive complication of diabetes. Diabetes can produce impotence. We all know that. When you want to have sex and when you want to have an erection, it's the brain, it is the mind which decides. Today I want to talk about a person who came to me with what we call as a secretive complication of diabetes. He had a sex problem, he had impotence. So normally when patients come, they don't talk about it. We also are shy to ask people, but sometimes it troubles them so much that they come out with it and they say, "Doctor, I want to talk to you something confidential." And then they open out and say, "Doctor, I'm not able to have sex, I'm having impotence." Now, diabetes can produce impotence. We all know that. Long-term diabetes, when the blood vessels or the nerves are damaged, in men, you can have a lack of erection, and that is what we call as impotence. In women also, there can be a lack of sexual interest, and therefore sexual disorders are quite common in people with diabetes. But what I want to tell you was about this particular patient who came. He said he had impotence, but then there are certain tests to find out whether it is psychological impotence or it is true organic impotence. Now, when patients complain of impotence, 70 to 80% of it is psychological or psychogenic impotence, which means there's nothing wrong with the sex organ, there is nothing wrong with the nerves or the blood circulation, and it's more psychological. You may say, how can you get psychogenic or psychological impotence? Now, when you want to have sex and when you want to have an erection, it's the brain, it is the mind which decides. Because without that, without thoughts coming, you cannot get an erection. So in this particular patient, the problem was not long-term diabetes. How I suspected that was he had diabetes only of 2 years duration. It was fairly well controlled. He was only about 35 years old. So this is not the scenario where you get the organic impotence due to diabetes. So after I analyzed the history, I found out that he was sleeping very late, he was having a bit of depression, he had some job stress. These were the things which were worrying. And the problem with impotence is, once you start thinking you have got impotence, it will get worse and worse, because you are thinking, oh, I'm impotent, I will not be able to perform, I will not be able to satisfy my wife. And so this problem grows on you. All that we needed to do was some psychological counseling, talking to him, telling him that he does not have organic impotence, and we showed to him that all he has was a psychological problem, and with the help of a counselor and of course getting the diabetes under better control and small little tweaks that we did to his medication, because sometimes medication, beta blocker drugs which are given for hypertension, they may also produce impotence. So if you stop that and change it to some other drug, the impotence can go away. So what I'd like to tell both men and women is, don't conclude that you have got impotence. Come to us, let us evaluate, tell us, don't be shy. You tell us your problem, what exactly you're having, and maybe there's a simple solution for it. You may not even have impotence at all. What if you really have organic impotence? Don't worry, even for that there are drugs. There are many drugs today which can be taken, which will help you to have normal sex. So we call this as a secretive problem, which nobody talks about, the secretive complication of diabetes. But remember that don't keep it as a secret. discuss it with your doctor, and most likely there is a simple solution. But above all, don't forget to keep your diabetes under good control.